Hello again, Dr. Greg Alexander with the Pediatric Office of the Future videocast series for 2011, and I'm joined today by Roger Downey, who is the Communications Manager for GlobalMed, a new sponsor this year with the office. So first of all, Roger, thank you for sponsoring this year, and thank you for joining me today.
Dr. Alexander, it's our pleasure that GlobalMed is involved in the Office of the Future, and I think what you're going to find this time when you visit the Office of the Future is technology that is changing healthcare. Actually, technology, we think, is healthcare reform, because what it does is it brings patients and doctors together no matter what the distance is.
And I've had a little bit of experience with that, but maybe you could describe for the viewers exactly what the outreach is. What does telemedicine enable for physicians or patients?
Telemedicine can really do a lot of things in just about any setting. If you want to bring the patient and the doctor together because they're separated by distance, that's one aspect. Let's say a pediatrician is on call at a hospital and in the middle of the night gets a phone call. Normally, that pediatrician would probably have to drive in to see the patient because a picture is worth 1,000 words. But with telemedicine, they could easily just fire up the laptop, link to the telemedicine cart in the room that where the patient is, and visually inspect the patient. Sometimes the color of the patient's skin can tell you just how serious a pediatric patient is. But in this way, you would know, number one, if you had to drive into the hospital right then, or if you could wait until actually it was morning and you could go in at the regular time. Those are a couple of the aspects that telemedicine can do, but it's also a situation where globally a patient in Latin America or some other island out in the Pacific could link to a specialist and get quality health care that may not be available in their local area.
And this is stuff that could be used as well for outreach into extending reach into prisons or schools or rural settings where specialists are few and far between, ways that we can expand our capabilities without necessarily stretching ourselves too thin.
That's exactly right. In every setting that you sort of mentioned there, the corrections and rural settings, those are currently being done. That's happening right now. We're not talking about the future or science fiction. We're talking about science fact.
Excellent. Just a personal aside here, one way we've used telemedicine in our little hospital, the nearby in Columbus, Ohio, Nationwide Children's Hospital did an outreach program. We were able to get some telemedicine equipment in our little level 1 nursery. And when a mom delivers a new baby and the baby has whatever trouble and is transferred to the neonatal intensive care unit, mom is still with us. Instead of the doctor seeing the patient, in this sense, it's the mom seeing her baby and enabling that bonding, that connection that we might take days for her to actually get over there if she recently had a C-section or whatever. So there's a lot of different uses for this. Really powerful stuff.
There is. And, who can say what a mom is feeling when she doesn't have that close contact initially with her baby. So having that image and being able to check to see what the baby is doing just adds a lot of, lessens the feelings of separation.
And it's really powerful. You can see it on the mom's face when you make that connection. So I did want to mention before we run out of time, you guys are giving a talk in our new Tech Talk Theater at 3:30 on Sunday called Saving Costs and Lowering Risks in Telemedicine. So maybe you just briefly describe what you might be mentioning there.
Well, this is happening in small hospitals around the country where there are no specialists, and when someone presents with cardiology problems, whether they're pediatric or adult patients, or neurology problems, perhaps a possible stroke victim, they can access a specialist hundreds of miles away who can assess the patient and tell the hospital whether that patient needs to be transferred to a higher level of care. If not, the patient stays in their community and perhaps is released, who knows, the next day, rather than going 100 miles away to a hospital and being released 2 or 3 days later.
Excellent. I look forward to seeing it, Roger. I look forward to seeing you in Boston as well. Thanks for joining me today.
Thank you, Doctor.
And thank you as well, folks. This is Dr. Greg Alexander yet again for the Pediatric Office of the Future videocast.